A positive result on a pregnancy test kit isn't what Lorraine was expecting at this time. While having a baby is a blessing, pregnancy isn't part of her plan just yet. She's still getting the hang of being a mother to her 11-month-old son, but she failed to get an injectable contraceptive just before Metro Manila was placed on a lockdown.
Wala nung nag-quarantine, hindi na po ako nakapunta ng sente kasi pumalayo din po yun. Hindi ko sana masusundan agad. Kasi po plano ko talaga palakihin muna siya, magpo-focus muna ako sa isa. Gusto ko mga after 5 years, magbubuntis ako, kaso po yun biglaan.
The Commission on Population says nearly half of the women of childbearing age in the Philippines have limited or no access to contraceptives due to the pandemic. At this center alone, barangay health workers are swamped with work.
At least 300 people have been visiting this barangay health center in Taguig City every day since the government eased the quarantine restrictions. Many of them are either getting their medical certificates so they can go back to work or taking their children here for immunization.
There's barely enough time or people to give house-to-house family planning services like they used to.
Mga 50% nakakapunta ng health center. Ginagawa pa rin ng BHW namin yung house-to-house, pero hindi pa rin lahat unless may yung free na transportation. Sobrang hirap po. First, exposed pa kami. Exposed, tapos very limited lang yung staff. Pero ginagawa na pa rin namin lahat para matulungan sila.
The Population Commission projects around 200,000 unplanned pregnancies nationwide this year and another 200,000 in 2021. A third of a family's budget is used to cover the cost of pregnancy. But with millions facing job loss or salary cuts due to the pandemic, unintended pregnancies are seen as a step backwards in the government's effort to fight poverty.
Any increase in any newborn in a family, particularly if unplanned, makes the family dip into its savings. And if you do not have savings, if you're poor, if you're among the 20% or so who are deemed yung poorest of the poor, you have nothing to rely on.
Lorraine has yet to figure out how to fit pregnancy expenses into their budget. She has no job and her husband's work on the construction site doesn't pay much. They didn't get cash aid from the national government either.
Sa loob ng isang linggo, may kita siya ng 3,000. Sa dami rin po ng gastusin, minsan natitira lang po 1,000. Iisip ko din po yung mga gastusin. Kapag manganganak ka daw, mas marami kang gastos. Itong panahon na to na may COVID.
The Commission also worries the pandemic may cause an additional 500 maternal deaths.
These 500 probably did not have COVID, but because of COVID, walang services, they delayed going to the hospital and they bled to death.
And 6,000 child deaths this year because of malnutrition amid the pandemic. POPCOM has been distributing pills and condoms since the community quarantine began. They even set up family planning hotlines. But at the end of the day, the Commission says the solution still all boils down to responsible parenthood. Caroline Bonquin, CNN Philippines.